All right, we call to order this joint informational hearing of the Senate Public Employment and Retirement. Okay, call to order this joint informational hearing of the Senate Public Employment and Retirement Committee and the Assembly Public Employment and Retirement PERS Committee. And good morning. I'm Dr. Richard Pan, Chair of the Senate Committee on Public Employment and Retirement. I'm pleased to have everyone here. I'd like to welcome our guests and my colleagues here at the dais. Well, thank you so much for being here today. And I'd also like to welcome our speakers. Look forward to your testimony and very interested in the information that you'll be presenting. You know, many of my constituents, as well as my co-chair's constituents, are state employees right here in Sacramento. And as physician and a legislator, I'm committed to building safe and healthy communities in the region. And public health research on social determinants of health show that health is mainly influenced by your social and your physical environment. And certainly for state employees, the state of California creates the environment in which their employees work. And an unhealthy work environment may increase both state health care costs and retiree health costs. More importantly, worker productivity and satisfaction also is decreased with an unhealthy work environment. And many employers recognizing that promoting wellness is good for both their employees and their business. So today's hearing will provide an opportunity for our members to become more familiar with Healthier You, the state's health workplace wellness program, and other similar workplace wellness programs are being implemented throughout the state. Our objective here today is to learn what is occurring in the state with respect to attempts to improve state employee workplace wellness and to hear about other wellness programs that have been successful. And while we are going to focus a bit on the workplace, I recognize that actually we also need to think about not only where our employees work, but also where they live and what we can do as a broader community as well. So it is certainly in the interest of the state of California and the public that the state invest in wellness and a healthy environment where both their employees work and live. So I'm very excited to have this hearing today. I'm pleased to be joined here by my Assembly colleagues, Senator Cooper, who also gives remarks, and now let him introduce his colleagues on the Assembly side. So, Senator Cooper, welcome.
Thank you, Dr. Pan, and good morning. I'm Assemblyman Jim Cooper, Chair of the Assembly Committee on Public Employees, Retirement, and Social Security. And I'd also like to welcome everyone here today to this hearing, and thank you for participating on the various panels. Over the last several decades, the epidemic of lifestyle diseases has developed in the United States. Unhealthy lifestyles, such as inactivity, poor nutrition, and tobacco use, are driving up prevalence of chronic diseases such as diabetes, heart disease, and chronic pulmonary conditions. These chronic conditions have become a major burden for all of us as they lead to decreased quality of life, premature death, and disability, and increased health care costs. Additionally, although chronic disease was once thought to be a problem of older age groups, we are now seeing chronic conditions start during a person's working age. This is placing an economic burden on our state and its employers because of illnesses related to loss of productivity due to absence from work and reduced performance while at work. There's good news, though. We can do something about this. Studies have shown that wellness programs can achieve statistically significant and clinically meaningful improvements in numerous areas, including exercise frequency, smoking behavior, and weight control. I look forward to hearing today about how we're working together to create not only a healthier state workforce, but also a healthier workforce throughout California. I am pleased to be joined here today by several of my committee members, and at this time I'd like to acknowledge the presence of Assemblymember O'Donnell. Welcome and thank you for your attendance. This concludes my opening remarks, and thank you, Dr. Pan, for the opportunity. I will also be having to leave just prior to 11 for another meeting.
Okay.
So I apologize.
All right. Thank you. Senator O'Donnell, did you wish to make any opening remarks? Okay, excellent. All right. Well, also, let me call up our first panel here on healthcare costs and employee health, the benefits of successful wellness programs. We have Karen Palish from CalPERS and Tom Carter from Kaiser Foundation Health Plan to open up our discussion today by reviewing their organization's experience and findings and studying the impact of workplace wellness programs, improving healthcare, employee health, and reducing constraining healthcare costs. Welcome. And thank you.
Good morning, Chairman Pan, Chairman Cooper, committee members. Karen Polish, Acting Assistant Division Chief for Health Policy Research, CalPERS. Let me start by saying that CalPERS has a long history of responsible and efficient purchasing of health benefits and contracting with health plans to provide quality care for our members and their beneficiaries. Part of CalPERS' stated mission is to promote wellness for members and beneficiaries, and so we have researched and piloted numerous wellness approaches over the years. Today I'm going to share some general information about our membership, including demographics and health status, an overview of our current wellness efforts and challenges, and some items for consideration when implementing wellness from our perspective as a purchaser. CalPERS purchases health benefits for more than 1.4 million employees, retirees, dependents. That's from state, public agency, and school employers. Over the past 10 years, we've noticed a slight increase in the percentage of public agency members receiving health benefits through our program, but generally it's a 60-40 split between state and public agency members. Of the state subscribers, it's interesting to note that approximately 55% are actively working and 45% are retired. So the main takeaway here is that unlike many private sector employers who provide health benefits only for their active workforce, we cover health benefits for members' entire lives. One question that we often ask ourselves is, what are our cost drivers? CalPERS is expected to spend in excess of $8.5 billion in 2016 to provide health coverage for our members. Knowing that health premium rates are, in part, driven by member utilization of services, each year we examine health benefits utilization data to identify trends and ways that we might improve the health of our population and mitigate premium increases. One thing that's been relatively constant in the CalPERS population is the rate of episodes of care for chronic conditions. For analysis purposes, we define a chronic condition as any one of the following: asthma, coronary or heart disease, congestive heart failure, chronic obstructive pulmonary disease, depression, diabetes, hypertension, or rheumatoid arthritis. In general, we know that in any given year, approximately 25% of members with an existing chronic condition account for approximately 50% of all medical costs. To illustrate, in 2009, 50% of the overall healthcare spend, at that time that would be $3.5 billion, was for 1 in 4 members with a chronic condition. To drill down a little on that number, in the basic plans, 1 in 5 members with a chronic condition accounted for 42% of the basic non-Medicare spend. And in the Medicare program, 1 in 2 had a chronic condition and accounted for 68% of the Medicare spend. Today, not a whole lot has changed. The cost ratio remains about the same, and the lack of improvement in the health of our members means that approximately $4.25 billion out of the $8.5 billion that we'll spend in 2016 is attributable to chronic conditions, many of which might be improved with exercise and healthy eating or some other targeted intervention. This cost is an important reason that CalPERS is interested in employee wellness programs, but we're also very interested in improving the health and well-being of our members. Now I'd like to discuss just a little bit about CalPERS' current state of wellness and the efforts that we've undertaken. CalPERS currently relies on its 6 contracted health plans to promote and administer wellness programs for our members. Each health plan offers a variety of unique services, programs, and utilizes their own contracted vendors, products, and services with minimal coordination from CalPERS. Because CalPERS and employers are outsiders in this wellness model, we spent much of 2014 speaking with employers to better understand their needs and desires in this wellness space. Additionally, in 2014, we included a question on our annual health member plan survey about worksite wellness. It's interesting to note that of the basic members responding, fewer than 25% on average reported participating in a worksite wellness activity. Approximately 45% said that no worksite wellness was offered, and 15% didn't know if worksite wellness was available at their place of employment. So it's clear that there's an ongoing disconnect between CalPERS wellness offerings and worksite wellness efforts. To address this disconnect, one thing that CalPERS has done is partner with others to implement worksite wellness pilots. Numerous CalPERS worksite wellness pilots have shown us that employer and labor collaboration is essential for any health and wellness strategy to be successful. One pilot you will hear more about in detail today from the next group of presenters is the Healthier You pilot that began in 2012. This pilot is a collaboration between the State Treasurer's Office, the State Controller's Office, California Department of Human Resources, California Public Employees Retirement System, Service Employees International Union Local 1000, and Kaiser Permanente. The underlying framework of this pilot is based on actively engaged leadership, labor collaborating to promote programs, and fostering teams to provide support and facilitate innovation. Another worksite wellness pilot that CalPERS participates in is the Bay Area Rapid Transit, or BART, On Track to Wellness pilot. Although this pilot doesn't include any state employees, it did reaffirm our experience that labor and management participation and collaboration are key to success. Now I'd like to talk some about considerations regarding wellness programs from a CalPERS purchaser perspective. CalPERS has not only a large membership, but a diverse one. We serve employers, active employees, retirees, spouses, and dependents. The geographic dispersion and diversity of work sites, as well as the unique communication needs of wellness program participants, must be considered when selecting wellness solutions. Employers typically implement wellness solutions. They can create and maintain a culture of wellness, and they can engage and sustain employees' independent participation. In contrast, CalPERS, as a purchaser of health benefits, isn't in the optimal position to identify member-specific wellness needs and doesn't have the sources to case manage health and wellness for our entire membership population. We also can't incentivize participation the way that employers can. Ultimately, wellness solutions have associated costs, and these costs must be accounted for. For an example, one option that CalPERS has recently considered was, in order to implement a health and wellness solution across the entire membership, we would roll the wellness program cost into health premiums. Spreading the cost across the entire population reduces the individual impact in your premiums. However, any cost increase, no matter how minimal, can put the CalPERS plans closer to the Affordable Care Act's excise tax on high-cost employer-sponsored health plans thresholds. Although the excise tax has recently been delayed to 2020, CalPERS is still very mindful of the impact that rate increases have to the risk of our plans exceeding the excise tax, and adding a benefit would likely require either eliminating others or adjusting the benefit design to a lower actuarial value. Additionally, any change to CalPERS benefit structure would require stakeholder engagement and approval by the CalPERS board. It's important to note that we're not ending our current employer wellness pilots or reducing employees' ability to access and utilize the benefits that are currently offered by our health plans. These costs are actually already included in the premiums. But yeah, at this point, CalPERS has, our pursuit of an additional wellness benefit has been put on hold. In November of 2015, we actually went to the CalPERS Pension and Health Benefits Committee to discuss this particular issue, and the committee chose to defer further development of a statewide wellness platform due to the risk associated with the excise tax threshold and the unknowns in that area. I want to thank you so much for letting me speak today, and I hope that this presentation was helpful to you. At this point, I will hand off to my colleague from Kaiser Permanente.
Okay, thank you. Before we begin, I just wanted to also acknowledge and welcome Senator Cooley. Welcome, and we'll take questions after the end of the panel. That's right. So, all right. Thank you.
Great. Good morning, Chairman Pan and Chairman Cooper and committee members. I'm Tom Carter. I'm Vice President of the Workforce Health Consulting Group and also lead Kaiser on the Job, which is our workers' comp, injury care, and occupational health and safety services division at Kaiser Permanente. I'll start by giving a little background on sort of why Kaiser Permanente is so interested in workforce health specifically over these last few years. First and foremost, Kaiser Permanente is a care delivery system first, and not really we're a health plan that gives you access to a very unique care delivery system. It's in our DNA to always have been focused on population health, so we see our populations as one population that we keep healthy, deliver care at the right time, in the right place, and in the right mode or modality. And it was what we found was it was critically important to begin to translate what the evidence has shown in population health management to the workplace and the work sites, specifically employers, our labor partners, and other participants in the journey that we've been on. So it was really something that we've sat back and said, what's working within population health, and then how does it show up at the workplace? So as we thought about that, what became obvious was, as Chairman Pan said earlier, it was really not to be thought of as more of a benefit strategy, but as more of a business strategy. So you really have to think about what is it that we are doing as sponsors of our employees' health at the workplace around policy, environment, and being a health advocate when employees show up to work. And it was less about when you're sick, go see your healthcare provider. And so it was really a wholesale change in how to think about health at the workplace. Obviously, with public employees, they stay a long time with their employer, and so you tend to reap the benefits because this is a multi-year strategy. When you think about changing behavior and getting people healthier over time, it tends to fit better in a public agency setting, in a state setting, because of the fact that people stay a long time, so you'll tend to reap the benefits in the long run. The other reality that we found was, and this has been especially over the last 10 years, the percentage of the workers' comp dollar associated with health care has now crept all the way up to over 60%. That used to be about 10 or 12 years ago, that used to be at 20 to 25%. And most of the cost of a workers' comp claim was lost time, so what they call the indemnity portion of a claim. And so now as we started to look at the workers' comp industry, what we found was the majority of the costs associated with workers' comp was health care. And then when you double-clicked on that and dug a little deeper, you found it was the same modifiable risk factors that we were struggling with on the benefit side or on the healthcare benefits arena. So facts like 40%, smokers are 40% more likely to have a work injury. Diabetics are 5 times higher workers' comp medical costs when they are injured. And obese workers 2 times as likely to have a work injury, 7 times higher workers' comp medical costs, and 13 times more days away from work. So what ended up happening was it was obvious that we have one, if you treat the worker as one person, we've got multiple business issues associated with supporting our workforce in a healthy and a supportive way. What was unique about the pilots that we worked with in the state and CalPERS was, for us, the opportunity to leverage management and labor at the table at the same time. So as you heard Karen describe, there were many partners sitting down saying, how could we collectively, for the first time, for us to be able to sit down and work with everybody who's trying to help the same individual. And so the opportunity for us to activate the labor voice was very important. One thing we all know is that labor organizes very much around a cause, and this was a very important cause, as also a very, very strong communication. And one of the things that makes successful programs both sustainable and have better results is having a strong communication plan that employees and our labor partners trust who the information comes from. So not always will employees trust, Kaiser Permanente's message, though we've been very consistent in our message about health and well-being. When it comes from your local partner, whoever that may be, people will tend to listen more. So that participation was something that was very exciting for us as we partnered with Healthier You. The same with the BART pilot, being able to sit collectively early on and in the beginning with our labor partners, management, and us as a care delivery system, really sit down, what are the real issues around policy, environment, and health-related issues that we wanted to attack. When we talk a little bit about using data, that is where you start, sort of like once you have the passion and the focus in the right direction, the data and best practices to develop the strategy and the results-oriented program was something that was also a key component of the pilots we did. So not only did you hear about the CalPERS utilization statistics that we looked at, but also what information did we have as the healthcare provider. Also, the Health Enhancement Research Organization, referred to as HERO, has benchmark data that we were able to complete and then look at the best practices going forward. Interest surveys involving the employees and our labor partners and union members in what they were interested in so that we can meet them where they are, as well as just understanding how people were participating in physical activities and the like. So the multiple modes of intervention, kind of meeting people where they are, was a big part of our pilots. One size does not fit all. Even though the components and the approach you take is very similar, when you see one workplace, you see one workplace. And those factors are really what makes it sustainable, is to take those into consideration. The focus on key behavior change principles was also something that you'll find as you hear the other presenters talk about, specifically on Healthier You, were to leverage intrinsic motivation. So a lot of times people say, you need to pay people to change behavior. That may be short-term, very much so, but it's not something that's sustainable over time. So you really want to tap into people's intrinsic motivation versus extrinsic. So things like raffles, small giveaways, the messaging about we care about you, this is for you, not just we want you to participate or engage in an activity. Also developing support networks through unions and building teams was a big part of the sustainability of the pilot as it was set up. The other piece, as I mentioned earlier, was the involvement and continued engagement of the internal partners and leadership. the fact that during this pilot phase, all levels of leadership were participating, messaging, and engaging around how important this is, that we're doing this for you, and this is good for you personally, for the organization as well. But it was really about the individual that the message came across strong and loud. And then now we're at the point of actually being able to look at the data and people participating and engaging in different levels. And that now influences how we modify the plan going forward and kind of iterating it, kind of the rinse and repeat routine, where we'll now look at it, change it, and modify it, and continue to evolve as we go along. And at the end, the bottom line is, as we've begun to say, policy always trumps programs. A lot of times people think of wellness as kind of a product-oriented solution, and it really is thinking back much what we learned in safety. In workers' comp it was about policy, it was about environment, and how are we focusing on this, not just putting in a shiny object or something that was kind of programmatic or product-centric. It was really about how our policies and environments align to keeping people healthy and productive.
All right. Well, thank you. Thanks, both of you. Questions from committee members? Okay. All right. Well, I have several then. So, and again, I really appreciate all the presentations and the data in the presentations. And I guess my first question is for Ms. Pales in terms of CalPERS. One of the things that I've heard, and I don't know if it's true or not, is that our state employees, by the time they hit retirement, actually have higher rates of chronic conditions than other employees, and I don't know from you actually probably see more of the healthcare data. Is that true or not?
So it's very interesting that we actually looked at the data, and there's not much difference between the state population and the rest of our population in terms of the chronic conditions. Okay,
all right. So I mean, I think one of the things that as we're looking at wellness programs, and actually I think the point is actually it's not actually a program, it's really the policies, right? From CalPERS perspective, and I know we're going to hear from a subsequent panel about this about the Healthier You pilot, are we doing everything we can as a state to ensure that our state workers have a healthy environment in which they're working, that they can engage in activities that will help reduce some of these conditions? We just heard workers' comp costs go through the roof if you're obese and if you have hypertension and so forth. And you just mentioned all the chronic conditions that also that you're following, and the fact that you have a quarter of the members with these chronic conditions. Not all necessarily related to the workplace, but still, are we creating the kind of environment? I mean, are people basically, I won't say locked up in little cubicles and they can't exercise? People talked about the chair being perhaps one of the most dangerous devices to health known to man, maybe second only to cigarette. But I don't know your perspective on that. I'm not saying that people haven't tried, and we're going to hear about a wonderful pilot soon, but are there more things we could do?
Well, as a purchaser of health benefits, CalPERS does not actually have any strong influence in what the employer does on site, unfortunately, which is one of the values of the pilots, is to go out and incubate these ideas and see what works. And I think that's why you see the Healthier You and CalHR getting so involved. We don't really have the means as the health benefits purchaser to get into each workplace. We have more than 1,200 contracting public employers, and we just don't have the manpower to be out on the ground at each site to see what they're doing, unfortunately.
Well, let me ask you the next question then. Suppose an employer, like the state or one of your employers, actually makes those kind of investments in their own workplace. Are you able to, I guess, if they're able to show results, actually offer them lower premiums for their workers, for that work site, or for the people that work, I shouldn't say work site, though, that employer? And maybe that's actually a question for both of you, because Kaiser is also on the health end. I mean, are we able to get lower rates for people? So what happens is that, the workplace, the employer, the union works together. They don't have all the CalPERS. They have a piece. They're in one area, right? And they actually show we are able to lower our rates of chronic disease or get some benchmarks. Are they then able to get a better rate for those, or they just get said, well, actually we do rates for everybody, so it just gets washed into the mix.
Well,
So yeah.
rates are negotiated and developed based on the entire population and utilization and other cost factors. So it's not something that we can target by employer at this point. Overall, the goal would be to get the entire population healthier.
Right.
And I know that one of the interesting things that CalPERS is working on is a population health management work sort of product that we're working with our health plans to encourage more work around that to engage the employees more. But we don't currently have a way to target the employers. Employers can do things for their employees, but we don't have a way to negotiate separate rates for each location.
And I realize to a certain degree, CalPERS is very large. So it's both an opportunity and a challenge.
Yes.
Right. So the problem is, even I don't know what percentage of your CalPERS is state employees.
Well, if you
Roughly.
look at state enrollees, it's about 60%, but that includes all the retirees, dependents, and spouses.
Sure. Right.
So that's another challenge. Worksite wellness doesn't necessarily impact the rest of that group.
Well, eventually it will.
That's
Over
the hope.
time.
That's definitely the hope. Yeah,
So-
because they will become those people.
Right. But I guess the reason I'm asking that is, suppose even a large entity, I won't say the entire state, decides we're going to invest in wellness, but then what happens is that, suppose they're 10% of your, which is still huge, right?
Right.
And they'd say, we're going to invest and we're going to get stand-up desks and we're going to get gym, blah, blah, et cetera. And that's all money, right? There isn't a mechanism for which, and look, we got better results. For them to be able to then turn around and say, hey, we made all these investments as the employer, because you're right, you're the purchaser and you're the plan, and you have a limited ability to encourage people, but now they made those changes, and then you're going to come. There's no way to, when they come to you and simply say, well, actually, we're charging you the same rate as we charge the other 90% who haven't made these investments, and you've made these investments, but you know what, and your rates are better, your employees are healthier, but yet we're going to still charge you the same as we charge everybody else. That doesn't seem to be much of an incentive to do the change if you're looking and going, well, I put all this stuff in place, and I realize you can't do it for maybe small groups, but there must be some point where that's able to happen. Otherwise, it's going to be hard. I mean, that's the return in many ways. I mean, one return obviously is the improvement in health, and it's great when people do things for the right reasons, and we really appreciate that. But it doesn't hurt that there's also recognition that, hey, it is saving the plans and saving costs, and therefore somehow that needs to be reflected back, that effort. So can you?
Yeah, the degree to which a change in, say, the state population's health would affect overall premiums is not something we can easily quantify off the top of our heads. It's hard to say what impact that would have. And as our process currently stands, we don't develop separate rates based on individual groups. It's something I could take back.
Okay. All right, because I just think that otherwise, I'm not saying people won't do it, but it makes it harder for pilots to be anything other than pilots, right? Because eventually, how do you make it self-sustaining, right? Part of the financial self-sustaining part is that, look, you did all this, and we're actually going to lower some of your costs somewhere, right? And one of them should be healthcare costs, because if you're actually getting better health outcomes and you're utilizing less, then hopefully you're not having to spend as much on that, because I put the money up front and doing all those environmental changes, which aren't free either, right? So
Understood.
Yeah.
Yes. Yeah. As it stands currently, as I mentioned, we don't have a particular approach for that. It's an interesting dilemma that we have discussed in the past. We don't have an answer readily available. It's right now the employers benefit by the large pool of lives, because it doesn't take more than one or two catastrophic events to absolutely
right.
undo all that fabulous work that you do on wellness. So it's a benefit and a risk at the same time if you were to be singled out. So there's two sides to that equation.